7 website mistakes that are killing your patient's bookings. You have spent money building your clinic's website. You have made sure it looked professional. Maybe you have added a banner photo of your smiling team and listed all of your services. And yet, the phone isn't ringing as much as it should. Here is something that might surprise you. Over 77% of the patients search online before deciding which doctor to visit. They are Googling your name, reading about your services, sizing up your website, all before they ever call you. If your website doesn't pass their silent test, they simply move on to the next clinic down the search results. And here's the painful part, you will never know they were there. This isn't about having a beautiful website, it's about having one that works, one that takes a curious visitor and turns them into a confirmed appointment. Most clinic websites fail at this not just because of bad design, but because of handful of very specific, very fixable mistakes. Now let's walk through them one by one. Why your website matters more than you think. Think about the last time when you tried a new restaurant. Chances are you checked it out online first, looked at the photos, read a few reviews, checked the menu. If the website looked sketchy or the information was confusing, you probably chose somewhere else. Your patients do the exact same thing with your clinic. The moment patient feels unwell or needs a routine checkup, a specialist, or a second opinion, their first move is to open their phone and search. They are looking for reassurance. They want to know you are qualified, that your clinic is nearby, the booking is easy, and that other patients have had a good experience. Your website has about 7 seconds to give them that confidence. After that, they are gone. The good news is that most of these problems are not expensive or complicated to fix. You just need to know what they are looking for. Here are 7 most common mistakes that are quietly costing you bookings every single day. Mistake number 1, book an appointment button. Mistake number 1, no clear book an appointment button. Let's start with the most obvious one and yet the most commonly ignored. I have visited most clinics website and I have found the same story. A phone number buried in the footer, a contact us page that leads to a basic form, no clear path to actually booking an appointment. Patients are left wondering, do I call or do I fill the form? Is someone going to reply? And here is the hard truth. Patients won't hunt for a way to reach you. They will just leave. Think of your website as the shop. If a customer walks in and can't find the billing counter, they don't wait around asking for help. They walk out. Your booking button is your billing counter. It needs to be visible the moment someone lands on your page. Here is a quick tip. Your book an appointment button should appear at the top of your homepage on every service page, even midway through your long content pages. Make it bold, contrasting colors, not white on white, not gray on gray. It should visually pop. Here is how you fix it. Add a prominent booking button to your website header, visible on every single page. Use action oriented text like book your appointment or see a doctor today instead of generic contact us. If you have a phone number, make it clickable so mobile users can call them in one tap. This single fix alone can meaningfully increase the number of people who reach out after visiting your website. Mistake number 2, your website loads too slow. Imagine a patient sitting in a waiting room, killing time on their phone. They search for a specialist. Click on your website and wait. The page spins and spins and spins. Within 3 seconds, they have hit the back button and clicked on the competitor's link. 53% of mobile users abandon a website that takes more than 3 seconds to load. In a world where everything is instant, cab booking, food delivery, video streaming, a slow website feels broken and untrustworthy. Patients associated with a clinic that's outdated and disorganized. Speed issues usually come from common causes: images that are too large, cheap website hosting that can't handle a traffic, or a website built on outdated technology. None of these are glamorous problems, but all of them are costing you your patience. Did you know a single second delay in your website's load time can reduce the patient inquiries up to 7%? If your website takes 5 to 6 seconds to load, you could be losing more than half of your potential bookings before they even see your homepage. Now, here is how you can fix this. You can go to Google PageSpeed Insights. It's a free tool where you can type your website's URL and it will give you a score and tell you exactly what to fix. You need to compress all images on your website using free tools like TinyPNG. Ask your web developer to enable browser caching and use content delivery network. Consider upgrading to faster, dedicated web hosting. You don't need to understand the technical details. Just share this list with your developer and ask them to do it. Mistake number three: your website doesn't work properly on mobile. Pull out your phone right now. Open the clinic's website. Can you read the text without zooming in? Can you click on the phone number with your thumb? Can you fill out the booking form without fields overlapping? Can you find the services menu without it breaking? If the answer to any of these is no, you have a mobile problem. And it's a serious one. Over 60% of healthcare related searches happen on mobile devices. Patients are looking you up on the go, from the office, from their house, from the auto, on the way to pick up the kids. If your website looks fine on the desktop but breaks on a phone, you have effectively invisible to majority of the people searching for you. A non mobile friendly website isn't just inconvenient, it signals to patients, consciously or not, that your practice is behind the times. It creates friction the, at the exact moment they are trying to decide whether to book with you. You can check your website. Open your website on both Android and iPhone. Try to complete a booking or find your contact number in under 2 minutes. If you struggle, your patients definitely will. Now, how to fix it? Ask your web developer to make the website responsive, meaning it automatically adjusts to fit any screen size. Ensure all the buttons are large enough to tap with a finger. It should be minimum 44 by 44 pixels. Test your contact and booking form on mobile. They often break silently. Use Google's free mobile friendly test to get an instant report. A mobile optimized website isn't just a luxury anymore. For healthcare practice in 2026, it's the bare minimum. Mistake number four: patients can't easily find your contact information. This one sounds too simple to be a real problem. And yet, go to your website and check right now. Is your phone number visible on the homepage without scrolling? Is your clinic address and timing listed clearly? Is there a map or directions link? If the patient has to click through 3 pages to find your phone number, you have already lost them. Patients who can't find your contact details within seconds will assume one of the two things: either you are not accepting new patients or something is off about the practice. Neither assumption leads to a booking. Contact information is a trust signal. When patients see your clinic's name, address, phone number, and hours right at the top of page, it tells them this is a real, established professional practice. When that information is missing or buried, now here is a patient insight. Studies show that patients are far more likely to call a clinic when a phone number is displayed prominently on the top right corner of the website, a spot that eye naturally travels in. How to fix this? Add your phone number, address, clinic hours to both header and footer of every page. Make sure that your phone number is a tap to call link for mobile users. Embed a Google Map widget and contact page so patients can get directions instantly. List your clinic hours clearly. Include whether you are open on weekends or for emergencies. Think of your contact information as a welcome mat. The more visible and inviting it is, the more patients will walk through your door. Mistake number 5. Your website has no trust signals or social proof. Let's be honest about something. When patients find your clinic online, they don't know you yet. They can't see your waiting room. They haven't met your staff. And they have no idea how you treat your patients. All they have is your website. So, what do? The same thing they do before buying anything online. They look for proof that other people have had a good experience. This is called social proof, and most clinic websites have almost none of it. No reviews, no patient testimonials, no doctor credentials displayed prominently. Just a list of services and a phone number. That's like a restaurant with no reviews, no photos of the food, no menu descriptions. Would you walk in? Patients are making deeply personal decisions when they choose a doctor. They they are trusting you with their health, sometimes with their life. Your website needs to earn that trust before they step through your door. Here is a patient insight. Research consistently shows that over 70% of patients read online reviews before selecting the healthcare provider. A single page of genuine patient testimonials can increase the booking inquiries up to 30% or more. The trust signals that work best on healthcare websites are as follows. Number 1, star reviews and ratings. Embed your Google reviews directly on your homepage. Real ratings from real patients are the single most powerful trust builder you have. The second trust signal is doctor bio with photos. A friendly, professional photo of your doctor with their qualification, years of experience, and areas of specialty make a massive difference. Patients want to see who they are booking with. Number 3, certifications and affiliations. Display your medical registrations, hospital affiliations, and any specialty certifications. These may feel routine to you, but they are deeply reassuring for a patient. Before and after case studies or patient stories. With proper consent, even a brief 3-line patient story. For example, I came in with chronic knee pain and was back walking naturally in 6 weeks. Builds more confidence than any other marketing material. Media mentions and awards. If your clinic has been recognized or featured in publications, won a local award, or has been recognized in any other way, put this on your homepage. Here is an important note. Always obtain clear written consent from patients before publishing any testimonial, photo, or case detail on your website. This is both unethical as well as a legal requirement. Now, how to fix this issue? You can set up and claim your Google business profile and actively ask your satisfied patients to leave a review. You can add a what our patients say section in your homepage using the review widget. You need to write a proper bio for each doctor with real photos and not stock images. You can also display your medical registration number as well as qualifications visible on the website. Trust is not built in one place, it's built in layers. Every credential, every review, every real photo adds another layer that moves a hesitant visitor closer to the booking. Mistake number 6, you have no online booking or your booking system is outdated. Here is a scenario that plays out hundreds of times across clinics every day. A patient feels unwell at 9 p.m. They search for a doctor. They find your website. They feel reassured by what they see. And then they hit a wall. Your website says, please call us between 9 a.m. to 6 p.m. to book an appointment. So they close the website. They find another clinic that lets them book in 90 seconds. And tomorrow morning, they show up there, not at your clinic. 40% of all healthcare appointments are booked outside office hours. That means nearly half of your potential bookings happen at the time when your phone is switched off. If your website doesn't offer online booking, you are handing those patients to the competitors every single night and at every weekend. This is arguably the most expensive mistake on this list because it doesn't just cost you one appointment, it costs you a long term patient relationship that could span years and dozens of visits. Here is a key statistic: clinics that add online appointment bookings to their websites report filling 24% more appointment slots per month compared to clinics that rely only on phone bookings. Here is how to fix this. Integrate an online booking tool directly on your website. Options range from simple calendar tools like Calendly to healthcare specific platforms like Practo, Docs app integrations, or custom built booking forms. Make sure that your booking system works smoothly on mobile. Most patients will use it on their phone. Send an automated confirmation message, SMS, or email the moment a patient books an appointment. This reduces no shows significantly. If a full booking system feels like a big step, start simple. Even a WhatsApp button that pre-fills a message like "Hi, I would like to book an appointment" is indefinitely better than nothing. You have worked hard to build your reputation and get patients to your website. Don't let a missing booking button be a reason that they walk away. Mistake number 7: your website content is confusing or written for medical jargon. Read this sentence: we offer comprehensive, multi specialty interventional procedures for acute and chronic musculoskeletal pathologies. And now read this one: we treat back pain, joint pain, sports injuries, and get you back to moving freely. Both sentences describe the same service, but only one of them makes patients say, "Yes, that is what I need." This is the content mistake that almost every clinic makes. It's written for doctors, not for patients. It's full of technical terms, vague service names, and formal language that makes patients feel that they are reading a medical textbook instead of welcoming clinic website. When a patient can't quickly understand that what you treat or who you help, they don't stick around to figure it out. They leave and find a website that speaks their language. Remember, your patient is probably anxious when they visit your website. They are worried about their symptoms. They are trying to figure out if you can help them. The easier you make for them to find the answer, the more likely they are to book an appointment. Here is a quick tip of plain language rule. Write your website content at a simple conversational reading level. If a 14-year-old can't understand your service, it needs to be rewritten. This is the same standard that WebMD uses, and that is why millions of people trust them for health information. Here is how to fix it. Rename your service pages to simple, plain language. Write diabetes management instead of endocrine metabolic disorder consultation. Start every service page with the patient's problem and not the solution. For example, living with a knee pain that won't go away. Here is how we can help. Break up walls of text with short paragraphs, bullet points, and clear subheadings. Add a FAQ section to every major service page. Patients always have the same 5 to 6 questions, and answering them upfront will remove hesitation. Use real photos of your clinic and team instead of generic stock images. Authenticity builds trust instantly. Your website's content is your clinic's voice. Make sure that it sounds warm, clear, and human. Now, how these 7 mistakes, which we have discussed before, add up. None of these mistakes exist in isolation, they compound each other. A patient who finds your website through Google search. It loads slowly, but they wait. Then they try to open it on their phone, but the layout breaks. They struggle through it. They can't find the phone number. They see no reviews and find the service page is full of medical terms that they can't understand. They give up and call the next clinic on the list. You have lost that patient at 5 different points, and you will never know they were there. Here is a quick look at where each mistake hits you the hardest. Mistake number 1: no clear booking CTA. It hurts conversions and the impact level is high. Mistake number 2: slow loading speed. It hurts the first impression and the impact level is high. Mistake number 3: the website is not mobile optimized. It hurts accessibility and the impact level is high. Mistake number 4, missing contact information. It hurts trust and the impact level is medium high. Mistake number 6, there is no social proof and it hurts credibility and the impact is medium high. Mistake number 7, there are no online booking and it hurts after our patients. The impact level here is also high. Mistake number 8, confusing content. It hurts patient connections and the impact level is medium high. You don't need to rebuild your entire website. You just need to fix the right things in the right order. I have shared a simple, practical 30-day action plan in the description below. You can find the link over here. Here's the bottom line. Clinics that fix these 7 mistakes consistently report a 30% to 50% increase in patient inquiries within 60 days without spending a single extra rupee on advertising. So here is a takeaway. Your website is not just a digital brochure. It's your clinic's most hardworking team member. It's open 24 hours a day, 7 days a week, and it either converts the visitors into patients or sends them to someone else. The 7 mistakes covered in this video are not rare or unusual. They exist on majority of the clinic websites right now. The practices that fix them aren't just getting more bookings. They are building lasting patient relationships that grow their reputation year after year. Start with one fix today, and by the next month, your website would be working as hard for you as you work for your patients. Now, if this video has got you thinking how patients find you online, you'll want to watch this video linked above. In it, we break down exactly why so many clinics are invisible on Google even when they are doing everything else right. And this video will also walk you through step by step fixes that can get you in front of patients who are actively searching for your care. Now, before you dive into fixing your website, there is one problem that comes even earlier: patients not finding you at all. In this video, you will see exactly why clinics disappear on Google searches and how you can fix that fast. These two go hand in hand, so don't miss it. Thank you.